Welcome. This is the first Google Hangout organised by Public Health Wales. So it's going to be a little bit of an experiment, and anybody who's watching, welcome, but I hope you'll allow for perhaps this won't be a BBC production quality. So we've promoted this quite hard, and it's just an opportunity for people to meet Tracey Cooper, who's our new Chief Executive, and I'd like to say hello to you, Tracey.
Hi, Chris.
That's great. And the other person who's asked to join us on this Hangout is Joe Charles, who Joe, would you like to introduce yourself?
Hi, yes, I'm Joe Charles. I'm Associate Director for Public Health in North Wales. Work very closely with 6 local authorities in North Wales and with Betsy Cadwallader Health Board. And I've got the pleasure of sitting in my dining room to do this, which is great.
That's great. Well, welcome. Welcome both. And my job is just to facilitate the discussion. So, Joe, the floor is yours. Ask away.
Okay. We started a Twitter conversation earlier on this evening, Tracey, so I thought it might be helpful to perhaps pick that up. It was just I had the pleasure today, really, of attending a different kind of event to ones I've attended for a while. So I went to the Welsh Local Government Association conference in Llandudno, and I was quite surprised, I guess, that I was actually the only NHS person there, and it just struck me that actually it was, in lots of ways perhaps a missed opportunity, and so I just wanted, perhaps for us to think about how we can make sure that we're keeping our ties and getting up closer all the time with local authority colleagues.
Joe, hi again. We met in Llandudno last week, so it's really nice to see you. And thanks for joining the Google Hangout. And can I just say before we start the conversation, I really like the door that you've got behind you in your dining room.
Oh, thank you. That's my cupboard. It's a built-in cupboard.
Oh, very nice, very nice. Well, I saw your tweet, and it is disappointing that we didn't have more NHS people at the event. I think we had a brief conversation about this last week, but from our perspective, going forward from a broader health and social care agenda. And public health being involved in that agenda, how we work closely with colleagues in the local authorities is actually going to be fundamental.
Yeah.
So I think it's great that you were there, and thank you for being the whole of NHS Wales in one person. But it says a lot, as you say. It's quite symbolic that more of us weren't there, and kind of worrying at this stage. And I'm sure there's lots for the local authorities to discuss today, and for people joining us, hi to everybody joining us, but we're talking about a large conference that happened in Llandudno, looking at what will be coming down the line and some of the future for local authorities in Wales. So, Joe, I'd be interested in your thoughts about what you heard, and perhaps what are the take-home messages for us?
Yeah, absolutely. I guess one of the things was quite some time since I've been to a local government conference. It's probably about 3 or 4 years ago, and most of my most recent work has been very much with the NHS. So I haven't had as much involvement with local authority colleagues. And I guess the one thing that took me by surprise, because I'd forgotten about it, was just how close colleagues in local government are to the politics. And it's the politics with a big P and the politics with a small p as well. And actually, part of me, as we were going through the day, I was sort of thinking, gosh, I'm glad. In a way, I'm glad I don't work in local government, because of that proximity to the politics. It must be really, really tough for our colleagues working there. For me, there was there was some absolute moments of joy, really, in terms of listening to, particularly in breakout session. I attended a breakout session that was asking the question, what does well-being mean for the people of Wales. That, wow, it's a gift for us, isn't it? You know, an absolute gift of a question and a gift of an opportunity. You know, to really, you know, sort of, and for me it felt like there's an open door there for us to work very closely with local authority colleagues, you know, to help them on their journey, and also, of course, it's the same journey that we're on in terms, and the Leslie Griffiths, the local government minister, she opened the conference, and one of the things that she said, you know, talking in the context of local government reform potentially, was about how it's all about going right to the heart of relationships with people. And again, for me, that rang so many bells, particularly in terms of the stuff that I've been thinking about when I was preparing to go there. I thought, if I get an opportunity, what are my key messages going to be? So I was going there prepared to think and talk about, you know, 5 ways to well-being, mental well-being, all of that kind of stuff. And it's really, you know, it was you know, an open opportunity, and you know, so that was a bit, it just reflected, you know, to me that, you know, that having, you know, more NHS people, more public health people at those opportunities, you know, it's you know, it helps us to, you know, to be able to identify where that open door is. That sounds a bit backwards, but yeah. So that was absolutely fascinating. There was a really interesting set of discussions around diversity as well, and that again was really timely for me, particularly because we, as part of Public Health Wales statutory mandatory training, we'd had a fantastic training session yesterday on equality and diversity. As part of our statutory mandatory. It was just fantastic, you know, and listening to some of the discussion about diversity. And I think it was Leslie Griffiths again who sort of said, you know, talking about diversity, and she said something about that 60% of councillors in Wales are over 60, 70% of them are men, and 98% of them are white.
Wow.
You know, and you know, it's not pointing a finger at local government, is it? Because, you know, I guess there's perhaps not much different in some bits of the NHS either. But you know, the whole thing about diversity, and one of the other things that she mentioned, which I hadn't heard about before, which I think again is a really important opportunity for us to seize, was that she's actually asked for diversity champions for each local authority. So I thought, you know, there's another, you know, potential set of links for us, isn't there? You know, people, you know, who we can talk to in our language, and, you know, and theirs as well. So yeah, sorry, I could go on forever, but
well, I think that's fascinating, and what's a lot of conversations that I've had so far in Wales, but also with colleagues in quite a few different countries around the world, is something about, someone mentions to me recently about boundaryless, that we're actually providing, whether we're working in the local authority or whether we're working in the NHS or education, in fact, we're providing services where we are located in similar places to the same communities, the same people.
Yeah.
And you know, we create the structures that prevent us working together. So, you know, if we can consider that for the benefit of the population, we remove boundaries and actually start, really, as you said, the really building relationships that are focused about what we can all do to promote and enable well-being, healthy populations. But that is the whole journey of health in all policies. On what communities can do to investing early years learning through to better education, better possibilities for employment, whole promoting working with the local authority about helping people be more self-aware about keeping themselves healthier for longer. And I think I don't think there's any excuse really for us not to do that now. And I think it's about the NHS and about the local authorities starting to break down some of those boundaries. And I'm sure you heard today, and we've been talking about it, and if colleagues who are linking in tonight who are maybe part of health systems in UK, Wales, UK or wider, that as our populations, as our people are getting older, and they need more support in the community, and they may need more healthcare, we actually have a duty to join up the thinking. So I don't think it's an excuse any longer for us not to be actively working with local authorities. And I think what you've said that's come out of the discussions at the conference, we could have had, it could have been an NHS conference in some respects. Similarities of the conversation. So I think from the take-home from Public Health Wales perspective is that we already have some variable relationships with local authority, and it is based on our teams and our people as to the extent at local level as to how well those relationships have been developed. But I think for us, from a corporate perspective as well as our teams locally, we've really got to start going out and engaging in a collaborative way, and seeing how we can work to improve outcomes for people across different aspects of well-being, but also the whole agenda of keeping people healthier for longer. So I'd be interested in some of your thoughts about how we could do that better.
Yeah, I'm interesting. You're saying about boundaries, because one of the other speakers was Hugh Vaughan Thomas, the Auditor General for Wales, and he was he put a map up to make the point about because a lot of the discussion was around the Williams report, the review, and the consequences of that, and where that's going to go. But he put a map up of the of some of the old medieval cantrevi in Wales, so the previous geographical distinctions, and the point he made was that actually people live in the communities that they live in, regardless of the lines that we put on maps between them. So that was absolutely fascinating for me. It's just that's true, isn't it? That people live where they live. So what we need to be doing is engage with people where they live, regardless almost of some of the the other geographical boundaries that that we've got, that local authority colleagues have got, that other because there were other representatives there from fire and rescue services, all these that it is about and about the whole thing of us not being afraid to to be with people where they are in their own communities. And for me, it's that challenge. I think that and in public health, I think we've sort of swung backwards and forwards from whether we're more associated with the NHS or whether we're more associated with local authorities, and that kind of discussion is becoming irrelevant, really, isn't it? Because where we should be is where people are. And populations. So I haven't quite worked out, how we do that, because the difficult challenge for us always, I think, is that we're relatively small in numbers of people, aren't we, within Public Health Wales? And for me, it's then about thinking, well, so where do we best place ourselves to be able to, as our strategic direction talks about, influencing, mobilising other people, because that's the key to it. That there aren't enough of us to be down in all the communities where people are. So how can we use our knowledge and skills to empower and skill up other people? So I guess for us, that's the key challenge, really, isn't it?
It is, yeah. And it's the change that happens at the local level, really, and I think it has to have the corporate support around that also. I'd be interested. Were there people from other sectors? Were there people from education, housing? Was it specifically quite pure local authority, or was it a wider group of people there today?
Well, I mean, they were mostly leaders, leaders of elected members of councils and and senior officers. So because they were covering the whole range of local government services. So there was a lot of discussion about education, and and again, for me that was really important, because they were talking very much about the fact that obviously we've had some local authorities in Wales that in terms of ESTIN inspections have been in special measures for some time, and the Chief Inspector of Schools was there to let people know that some of those local authorities have now come out of special measures in terms of education. And I was really encouraged by what she was saying about what are the things that have made it work better, and she was saying all the things that that we would say. It's about strong and visible leadership. It's about partnership working. And in an education sense, that was through local authority, with schools, with parents, with children and students. There were a whole range of things. I did write them down, because I thought again it was a real. In some ways, it felt like, oh yeah, this is a masterclass in public health, really. Masterclass in public health skills. So about openness and honesty. Really good use of data and information, and data for for action, and data for improvement, not just data for the sake of having it. About sharing what she called sector leading practice, and it just struck me that actually, yes, as you said before, it could have been an NHS conference, and we were at 1,000 Lives conference last week, and yeah, we were having the same conversation, really.
Well, I think it's. I think for us, we're probably facing the same things that many countries are facing at the moment. As far as personally, I think it's really a fundamental shift from us. Certainly, from a healthcare perspective, it's moving from the conversation solely about hospitals, because actually our model really isn't sustainable for our changes in society and population, and our need from a public health perspective to help people stay healthier for longer, and all of our other functions around safeguarding and protection. But a number of countries, and I think from our perspective, I think it's the commitments there is how we help implement that is from a public health perspective, i.e. the health of the population, is moving it from it being, as you say, it's a healthcare activity to actually it's actually a fundamental component for society, because if we want to be able to the great news of people surviving longer and living longer, but the increase and all the public health challenges that we know around smoking challenges, alcohol challenges, and as we live for longer, we're more likely to have underpinning long-term conditions. And so we may need to have more care and support at an earlier age, and if we have challenges around education and employment, perhaps we won't live as long, and we know we've got all the health inequalities. And so there really is, I think, a fundamental shift from how we, even from public health perspective, who we have tended to interact with from a pure public health world and role, to how do we shift that to the health of the population, which has to be everybody's business. Because as you say, it's about people living in communities. We're all members of the population living in the communities. How from a business perspective, if you like, how the plans from local authorities for health services, for education, are actually all aligned for helping better outcomes for people in the community. And those outcomes may be different. And so how, I think from a public health perspective, we should and we can help, as you say, that kind of neutral conversation to help people tease out what do better outcomes look like working with communities. So I think our role really has to start to spread into working really closely with partners, because it isn't just about public health, it is about the health of the population. So and I think there's a real momentum and impetus that has, from policy perspective, identified that. And we've been talking, Joe, and I'm sure you have with colleagues also about the public health bill that talks about a lot of these areas, and then what is going to be in the future generations bill. And again, for colleagues who perhaps are in Wales or not in Wales. These are two big pieces of legislation that are going through at the moment. And we think that the Future Generations Bill is about this conversation, really. It's about how, as a society and as a country, we actually make sure that everything is focused about the health of our population. And of course, that is about education, and that is about employment and children. But it's more than just health. It's actually about, societal well-being. So, I think it's going to be a growing conversation, and it's a conversation that's happening in so many different countries. So it's also how we can plug in with colleagues in the UK and wider. But because of the size that we are, we've got a real opportunity. Yeah. In fact, we haven't really got any excuse. Work closely with colleagues in this. I can see Chris twitching to get in actually at this point.
Well, we promised everybody that we'd be finishing at 8:30. There's no rule to say we have to finish dead on the spot. So I just wanted to remind you guys before you talk through the night that you may want to end at some point.
Yeah.
I mean, I'm just interested to know, do you think this is something which we should do again?
I think it's great fun. I mean, no. I mean, is it? I mean, I know we're doing it in an evening now. Are we just doing it in the evening because we're doing it in the evening? Is it the kind of thing you can sort of do any time of day? And does it cost? I mean, does it cost us to do it, or is this this kind of interaction part of what we should be doing all the time now?
Yeah.
Chris, what do you think? Cost-wise?
I'm really struggling to hear you. So.
Well, Joe, maybe I can respond, and maybe perhaps say something. I think it's great. I have to say, I think it's great, and I really appreciate your time. I think if we can do it more and more, maybe we can just gauge people's views to see what perhaps we can use a bit of social media to see what people think, what the best time is for people, and it would be great to get if other people want to join also. But I've really enjoyed it because I wouldn't have had a opportunity to have a conversation with you for a while. So great to follow up from the tweets actually, because when you were tweeting me, I was thinking I want to ask Joe how it went today, because we're watching closely with the local authorities as well. So I get just for Chris's sake to kind of close off. Maybe if I kind of just say a couple of words, and then maybe Joe say a couple of words. I just want to say thanks to Chris and Dan for kind of setting this up, and it would be great if we did more of this for a number of people, across the organisation, because we've got some fantastic people who know substantial amounts of around areas that are particularly hot topics for us at the moment. And Joe, thanks for your time and your evening. I've really enjoyed having the chat.
Yeah,
so, want to say something?
Yeah. One of the things that just occurs to me, because I know I guess one of the things that we've often talked about in Public Health Wales, and particularly from the local public health team perspective, that challenge of somehow sometimes not altogether feeling part of the organisation. It strikes me that this would be a brilliant vehicle for that. That just and if it's the kind of thing you could do as sort of a lunchtime learning session almost, something like that, I think would make itself available to more people, and I think would really help to sort of bridge that gap that I think some of it is real, some of it is probably perceived, but I think the more things we can do to make people just feel part of of this organisation, I think is fabulous, and not to exclude other organisations either, but it just feels like something that would be really helpful to us as an organisation.
I think that's a brilliant idea. I think a kind of lunchtime hangout, I think is an excellent idea. And I think our challenge, as you say, for people who aren't perhaps familiar with us, is that we're all over the country. We've got 1,400 phenomenally talented people working out of about 54 premises. So I think it would be great. And I mean, any other suggestions, if people are watching, any other suggestions that we can do to just kind of make people feel a little bit more connected. And it's actually, even if it's virtually, it's the face-to-face that makes a difference. So Joe, I mean, it would be really helpful. Can we connect up with you after this, and we can kind of reflect on it and get a bit of help from you to maybe we could perhaps send some engagement around with our teams to see if there's any certain particular topics that they'd want us to think about in advance of maybe doing one at lunchtime at some point. So that'd be great if we can have your help. Chris, do you want to say anything?
I just wanted to apologise for not following the conversation very well. Thank you, Tracey, for trying this out. Bit of a guinea pig. So 3 weeks in, I think you survived very well. Joe, thank you very much for joining us and making this real. Otherwise, it would have kind of not really been a hangout at all. So we'll reflect on this. Hopefully, anybody who's listening in will give us their views. There's loads of ways of contacting us through our website, publichealthwales.org, on email, by Twitter, by Facebook. Let us know what you think, and there may be all sorts of other opportunities we can use for this sort of conversation. So thank you all, and good night.
Good night. Bye.
Bye.